Now to Kerala, where the state has confirmed 71 brain-eating amoeba cases, 19 deaths so far as this year is concerned. A new case of amoeba PAM, a rare but often fatal brain infection, has been reported in Kerala, with a 17-year-old boy in Thiruvananthapuram confirmed to have contracted the infection. Now, the Kerala health authorities are on high alert after at least 19 people died this year from a PAM. This is a rare and often fatal infection caused by the so-called brain-eating amoeba, and it's the state health minister, Veena George, who said that there's no evidence of clusters linked to a single water source. Well, we have my colleague Uma Sudhir joining us in order to get us the very latest on this. Take us through what is it that the authorities are doing? What kind of measures are being followed? Because this seems to be going completely out of hand. We're talking about 19 deaths, and it is, while the government is saying that there is a spike, what is it that the government is really doing about this? What are the kind of advisory that are now out as far as the state is concerned?
So there are 72 cases that have been reported this year, and yes, 19 deaths as well. And the worrying aspect is that just in the month of September, we have seen 24 cases and 9 deaths, and that is what has brought about this health alert that that Veena George has declared. She's the health minister of Kerala, and yes, yesterday in the assembly as well, there was very heated debate with the opposition demanding that there should be an adjournment motion and a discussion on this. Veena George agreed for that, and she laid out all the things that the government is doing, the protocols that it is following, the kind of testing facilities that they have. And what she pointed out is that, this Kerala has been seeing this from 2016 onwards, and usually there would be a single source contaminated water and therefore a cluster of a disease. But now they are seeing sporadic incidents in multiple districts that includes Palakkad, Kozhikode, Malappuram, and as you mentioned, Thiruvananthapuram as well. And therefore, whether the transmission mode of this disease has changed is something that epidemiologists are now looking at. What the government is doing is having very early surveillance. Anything that looks like a brain fever, they start going in immediately for customized cocktail of antimicrobials and steroids as well. And that is the reason why, while world over you're having a survival rate of hardly 3 to 4%, in Kerala they're talking about 24% is the survival rate, because of which they are able to catch the disease early and get the testing done as early as possible. There are about 600 free living amoeba, and just about 6 of them are known to cause human disease, and this one is one among them, and it spreads through stagnant water that is warm, and if you come in contact with it, the nasal membranes is where the amoeba goes in and goes to the brain and starts eating up the brain, and therefore the progress of the disease becomes quite fast, and that's why early detection is a key to be able to prevent the spread of the disease. And the government has also issued advisories to people not to use this kind of groundwater, open water sources, or use swimming pools. There is no people-to-people transmission that has been known as of now, and therefore the government is trying to sanitize all these kind of water sources, chlorinate those sources as well. Kerala depends a lot on groundwater as well, and there is a tradition of taking a bath in ponds, open ponds, and that is something that the government has now asked people to avoid. Back to you.
Thank you so much, Uma, for breaking it down for us. And like Uma was saying, that amoeba that lives throughout the world in warm and shallow bodies of fresh water, such as lakes, rivers and hot springs, it also lives in soil. It's considered a free-living organism. Why? Because it doesn't need a host to live. People who become infected by this amoeba develop a condition called PAM. Now, PAM is a very serious infection of the central nervous system that's almost always fatal. Brain-eating amoeba infections, this is something, the symptoms include headaches, fever, stiff neck, confusion, amongst others, and seizures appearing rapidly after exposure. The most common way of being infected by this type of amoeba happens when infected water goes into your nose, like Uma was mentioning, and from there, the amoeba goes to your brain. This usually happens when you're swimming, diving, or doing something like water skiing in infected water. In extremely rare cases, the infected water can be it also can be as far as tap water is concerned. It doesn't really have to be swimming pools, and that isn't chlorinated enough. Now, you can't be affected you cannot be infected by swallowing infected water. But these are the symptoms, nausea included, fever, headache, vomiting, stiffness. Those are the common symptoms. Now, let's just also talk about what is it that the government is really doing about this. Now, Kerala's health authorities have issued a high alert after that significant spike in cases. We do know that Veena George has spoken about this. In fact, Veena George has been saying that the state is grappling with the serious public health challenge and the infections which were previously linked to specific clusters in the districts. Now, that has now been refuted by the government. And in fact, they are ensuring that swimming pools are adequately chlorinated. That is what the government is now saying. Now, well, this is something, unlike what we saw last year. We're not seeing clusters linked to a single water source, is what Veena George has gone on to say. There are single isolated cases which can get complicated. That is what she's saying. The minister stressed that the health department has stepped up surveillances with strict instructions to hospitals to investigate every case. Early detection, like Uma was mentioning, is key, highlighting that Kerala's survival rate of 24% is significantly higher than the global average of less than 3%, a success attributed to timely diagnosis and the use of anti-parasitic drugs as well. But basically, they need to avoid swimming pools or bathing in stagnant or unclear water bodies. But what are the people in Kerala saying? They're saying that some people have been infected by even taking a bath in their own houses. So it's not going outside, swimming in fresh water or going into swimming pools. But, so that advice that is being put out of using clean and treated water for nasal rinsing and cleansing. But, people who are using their water at home, these are the claims that are being made by people in Kerala, saying that there are some who've been infected by not having gone out into public water such as swimming pools or having gone into fresh water. Now, as far as homes are concerned, keep home water storage tanks clean and disinfected as well. So that is again another advisory that's being put out by the health ministry in Kerala. So those are the advisories that are being put out in order to ensure that they can curtail this. And people there are in fact being asked to avoid swimming pools, to avoid bathing in untreated water. That includes ponds, lakes, and even some wells.